Academic Alliance in Dermatology is a full-service provider. Dermatology nurse practitioner Keischa joins me to explain further how she can help and what ailments you may have that Keischa can help you with as well. Keischa, how are you?
I'm good. How are you?
I am well. So nice to meet you today.
Very nice to meet you.
I'm glad you're here, and I am an open book when it comes to the show, which is maybe a good or bad thing, depending on how you look at it. But I'm looking at these lists, and it's like, yep. And you say that some of these conditions that you came up with were actually the ones that you see the most in your office.
Mm-hmm. Yes, ma'am. Yes, ma'am.
So let's talk. We're talking not necessarily cosmetology, but issues that involve our cosmetics, and which, of course, plays into part of our confidence.
Right, yes.
I know this first one's a big one that people don't like to talk about. Hair loss.
Hair loss, yeah. Hair loss is a really big problem, and it's actually a pretty complex phenomenon too. I see lots of people that come in with hair loss pretty much on a daily basis. The problem with hair loss is that it affects everybody differently depending on your ethnicity, because our hair is all different. So then there's lots of things that kind of go into diagnosing hair loss and, you know, kind of maybe what the causes of the hair loss is.
And so, of course, then people are able to hopefully get some results or maybe like reverse it in a way. Is that what you're able to do?
Yeah, I mean, it really, like I said, kind of depends on the type of hair loss. So you have what they call scarring hair loss and non-scarring hair loss. So typically the scarring hair loss is going to be a little bit harder to treat than non-scarring hair losses, like maybe hair loss due to illness or maybe a drug-induced hair loss. Maybe if you're on, let's say, contraception or something like that, that might can contribute to some hair loss. So there are other things that can kind of contribute to hair loss.
Another thing that people don't necessarily like to talk about, especially as an adult, but we still do, acne. How do you help?
Acne is challenging because I see young kids with acne. I see all the way up to 40 and 50-year-olds with acne. In fact, actually, I had a 60-year-old male come in with acne not too long ago, too, and he had been dealing with it for a long time. So that's challenging. The thing about acne that kind of, I think, inspires me the most is that it can be such a scarring disease. I mean, it can create a lot of psychosocial distress, obviously, right? Our confidence, people look at you, the first thing they see is your face. Of course, I work in skin, so the first thing they always look at is my face. But I struggle with acne myself as an adult, so that for me is kind of like a passion, you know. We can't 100% cure acne for the most part, but we can get ourselves to a point where we feel confident in ourselves and, you know.
One more question with acne. There's so many products out there now, and we see so many commercials regularly. Why is it important to seek someone like yourself for help when it comes to acne?
Because really with acne, it kind of depends, again, on your ethnicity. Some of it, your genetics play a part into it. Maybe if your parents, you know, had acne. And then just tailoring an acne regimen to your specific skincare, especially if you are an oily type, or maybe you're an oily sensitive type, or maybe you're an oily normal skin type. That's going to change how we're going to prescribe products for you.
Well, this other one, too, is something that I've noticed with aging. Melasma. What is it? How can you help? We're taking a look, actually, at some of the doctors around there and some of your locations where you can get help for something like melasma. So
melasma is hard to treat. It's typically more in females, and it can be induced by lots of different things. Ultraviolet exposure, usually pregnancy is a very common, we'll say condition, but a common thing in a woman's life that kind of contributes to melasma. Genetics sometimes play a little bit of role in that too. So melasma is important because it affects a lot of people just the same as acne does, and people look at your face again, so you kind of worry about that. But there's many different ways to treat it. So if you don't come in and talk to a skincare professional, you may not know all the ways that you can treat it. And the most important thing, wearing your sunscreen, which kind of helps to prevent that furthering of the melasma.
That's key. Because sometimes makeup just doesn't do enough. We also didn't get to touch on anti-aging, which I know you have a lot of wonderful tips there. Anything really quickly about anti-aging that you can help people with?
The best thing you can do for anti-aging is definitely get a retin-A, which is a vitamin A. You want to use your vitamin C. It's an antioxidant. It kind of helps prevent those fine lines and wrinkles that we are all worried about. Chemical peels help, and sunscreen, of course.
And again, you don't know anything until you seek someone's help, like Keischa, of course, with Academic Alliance in Dermatology. There's the information on your skin. And also, I know you've got an exciting event coming up as well in March, International Women's Day. We're going to have more on that coming up, so stay tuned. In the meantime, thank you so much for your time today.
Thank you.